Good evening, and welcome everyone to a pivotal moment in our journey toward health, equity, and justice. Rising and resilient, transforming the generational impact of tobacco and Black lives. I am Dr. Sheldon Fields, the president of the National Black Nurses Association. The National Black Nurses Association is thrilled to collaborate and engage in such a vital dialogue. As an organization committed to advancing the health and wellness of Black communities, partnering in discussions that address critical issues is paramount to our mission. We believe that by joining forces with like minded individuals and organizations, we can effect meaningful change and create a more equitable healthcare landscape for all. Our enthusiasm to contribute to this dialogue stems from our dedication to promoting excellence in nursing practice, advocating for social justice, and eliminating healthcare disparities. Together, we are stronger, and together, we can make a profound difference in the lives of those we serve. And I want to be clear, we have the opportunity to make a profound difference by eliminating menthol cigarettes, a tool that has been used by the tobacco industry to target our communities for decades. Together, we confront the stark realities of tobacco's grip on our communities, amplifying the voices of medical experts and passionate advocates and activists and resilient young leaders who refuse to accept the status quo. Tonight, we unite in purpose, driven by the collective resolve to dismantle the systemic injustices perpetuated by the tobacco industry. So, without further ado, let us ignite the flames of transformation and welcome our expert guests who embody the spirit of rising and resilience. I want to bring into the conversation Elder Kristen John Foy, Minot Jones, from Making It Count, Manu. I got that one right. Dr. Enid Neptune from the American Thoracic Society, and Dr. Monica Wilson from Parents Against Vaping E-Cigarettes. I think we're still waiting for Dr. Elder Foy, but we're going to go ahead and get started. And we're going to start with Manu, and then each of you will proceed. I want you first to introduce yourselves and talk briefly about what brings you to our fireside chat and the work that you do to combat tobacco and what brings you to our discussion. So, Manu?
Hi, good evening, everyone. I'm Minu Jones. I serve as the chair of the Detroit Wayne Oakland Tobacco Free Coalition in Michigan. And I was really brought into this work. I've worked in public health for close to 20 years now. The organization that I helped to chair passed the smoke free ordinance in Detroit and Wayne County back in 2009, and then the state went smoke free. I grew up in a household with two menthol smokers, and I recently lost my father to COPD. I witnessed firsthand the tobacco industry's tactics marketing to our community. My mother worked for an advertising company when I was in high school. And at that time, that advertising company gained a contract that allowed her to pay models $10 an hour at a time when minimum wage was $3.85. All they had to do was pass out free cigarettes at the African World Festivals in Detroit. And at that time, we thought that this was a great thing. Single mothers would be able to make twice as amount of minimum wage at the time, and they got paid daily. Well, we didn't realize that they were hooking a generation on these deadly products. And now we're in a space in Michigan where we have a bill package that currently sits in the Senate waiting for a hearing. You may not know, but Michigan ranks last when it comes to tobacco spending in the United States, along with West Virginia. It's important that we have these types of conversations to stop the lies and rhetoric that is being spread by the tobacco industry to equip our people and communities to fight back and take control of their health. We should not be losing blacks and people to the rates that we're using them to losing them to in these United States. Thank
Thank
you.
you. Dr. Neptune.
First, I want to thank the organizers. I think this is such an important and powerful discussion and panel. Um, I am a child of the South. I grew up in North Carolina, rural North Carolina, and so I know the sweet smell of tobacco. And I
Mhm.
know the complex relationship these states have with that particular crop. But I also trained as a physician, and I'm a lung specialist, and I currently am on faculty at Johns Hopkins School of Medicine, and I serve on the board of directors of the American Thoracic Society and the Scientific Advisory Committee for American Lung Association. And the reason that that training is particularly kind of helpful is that there is no lung doctor in the US who does not, on a weekly basis, see the ravages of tobacco product exposure on the health of many, many, many people. But I became radicalized when I became involved with the American Thoracic Society to Tobacco Action Committee, when I saw in full relief the efforts of the tobacco companies to target the African American community, when I learned about what happened with the Tobacco Control Act and the horror of leaving out menthol because of all of these complicated relationships and dynamics. And I say it radicalized me because it made me aware that we just can't treat patients with these disorders. We have to advocate to make the policies, to make the regulations, to make our government serve the interests of patients who were targeted for addiction, not targeted to make a free choice, but targeted to be addicted to a substance that will cause a multiple of different disorders that amplify the disparities that we see every day. And so that's why I think becoming a tobacco advocate and a tobacco activist is kind of what I see as my important place in this discussion.
Thank you, Dr. Neptune. Dr. Wilson, your introduction.
Good afternoon, and I want to also thank the wonderful facilitators and the panel today. I grew up as well in a household with two parents who actually smoked menthol tobacco. And unfortunately, due to that outcome, I lost my father to that. And that led me into see environment where I knew I wasn't going to be a smoker. But unfortunately, those of my siblings actually picked up on actually engaging in tobacco use. And I was dedicated to telling anybody and anywhere, when I have my own children, I'm going to be an advocate. I'm going to go out and speak to the highways and byways. And so being a part of Parents Against Vaping and e-cigarettes has been a mantle. I represent the California region for Parents Against Vaping, and I have really been a part of the policy transformation to end tobacco and e-flavor products to get to our youth. I am really a staunch, my voice, they say, Monica, could you just stop talking so much? Because until we eradicate, like my colleague said, the tobacco company targeting Black lives. We have lost generations due to the targeting that has come, and I'm doing my best to educate young people, parents, get them involved in the work to prevent this from continuing to happen. And I will do that until my last breath on this earth. And so I'm just grateful to be here today, and I look forward to the discussion. Thank you.
Absolutely. Elder Foy, kindly introduce yourself, sir. You're on mute, sir. You got to unmute yourself. There you go.
There, are we good? Good
Absolutely,
evening.
sir.
Apologize. My name is Elder Kirsten John Foy. I'm the president and founder of the Arc of Justice. We are a national civil and human rights organization focused on racial, social, economic, and environmental justice. And I come to this fight as both uh, uh, a victim of Big Tobacco's billions of dollars marketing campaigns over the course of years, as well as an activist and advocate challenging Big Tobacco's relationship to the Black community. You know, the first Africans were enslaved and brought to the plantations of Jamestown, Virginia in 1607 to grow tobacco as enslaved people. And here we are 417 years later, and the relationship between Big Tobacco and the Black community is as heinous and genocidal as ever.
Mm.
We were enslaved and our labor stolen from us to produce tobacco. We were put in bondage to grow it and to harvest it. And today we are in biochemical bondage to Big Tobacco. And so the relationship has evolved, but its basic tenet has remained the same. Big Tobacco has profited off of the death of Black lives. And so it is incumbent, I believe, on every person of good conscience who recognizes that we must confront all of the vestiges of slavery if we are ever going to move past those vestiges, that we cannot do these things, we cannot evolve as a society and still allow an industry who was born on the backs of Black slaves, profited off of Black lives for 417 years, and are continuing to kill us in mass. And so, as a civil rights activist, I believe it's incumbent upon me and others to stand up in this time and challenge Big Tobacco.
Thank you all for those introductions. I'm going to move right into our questions, and I'm going to start with you, Dr. Neptune. How do you, or how does the long-term health effects of tobacco use disproportionately impact Black individuals and families in the United States? And in what ways do these disparities manifest across the generations?
That is such a wonderful question, because sometimes when we talk about tobacco and we don't link that to the diseases that plague our communities. So let's be specific. The health consequences of smoking are broad, and they include cardiac disease, they include strokes, they include cancer. These three diagnoses are the leading causes of death in the African American community. But it's not just that. It's that African American smokers develop these disorders with fewer pack years of smoking, because African Americans on the whole start smoking later in life, and they smoke fewer cigarettes per day compared to non-African Americans. And so what that constellation means is that there's a heightened susceptibility to the bad effects of smoking in the African American community. And one can imagine, because we all know with these chronic diseases that they invariably work to the detriment of African Americans. Now, the generational issue is interesting, because we all hear that 85% of African American smokers use menthol cigarettes. But what we don't hear is that that heightened use of menthol cigarettes crosses all of the age categories. Young African Americans use menthol cigarettes at these very, very high levels. Middle-aged African American use them at the high levels. And older African Americans use them at very high levels. So what that's telling us is that there's a preference that's communicated to the younger generations. Mm-hmm. And it's not just the preference, it's kind of a permission to engage in behaviors that are adverse to the health of our community. And when we espouse disinformation and rhetoric that suggests that we own toxins, that somehow these toxins are a part of our culture, we pass on that same disinformation to the next generation. And so we need to stop. We need to lay claim to the truth, to the correct information, and focus on improving the health of not just our generations, but the generations that come after us.
Thank you. I'm going to move my next question to you, Ms. Jones. How can community organizations and grassroots initiatives contribute to reducing health disparities among the Black community, and what support do they need to be successful?
All right. Thank you, Dr. Sheldon. You know, community organizations are often closest to the pain. They know firsthand what's going on in the community. They are often trusted by the community, and they are the experts of the community. The community knows what it needs, but they need education and awareness to understand the environmental factors that, you know, contribute to their poor health outcomes. It's time out for blaming us for bad behavior. Is not the case. The tobacco industry is behind the curtain, pulling the strings. Grassroots initiatives help. They help to educate and inform. They help to get resources where they're needed the most. But community organizations, right? We thrive off of supporting the community and getting support from the community. We have to have volunteers that support us, and not just volunteers or people who work in the public health sector, but all key stakeholders. So parents are important, youth are important, health professionals are important, people who work in media. Media is so expensive, right? But that's the way that we communicate in this day and age. So when we are looking to bring about awareness and spread education about this issue and dispel myths like Dr. Neptune talked about, we have to have financial resources in the community going to community-based organizations, directly to community-based organizations, right? So that they can craft culturally sensitive and competent messages that educate and speak directly to our people. We need to hear the messages in ways that matter to us. And we can only do that when we have stakeholders and people from the community volunteering, stepping up, sharing their personal stories, you know, to make sure that we have good messaging, good education that's grounded in fact and culturally sensitive for the audience that we're targeting.
Absolutely. Thank you for that. Dr. Wilson, what role do parents and caregivers play in shaping children's perceptions and behaviors regarding tobacco use? And how can intergenerational patterns of smoking be disrupted?
That's an excellent question. You know, children live what they learn. Role modeling is essential because children will mimic the behaviors of their caregivers and their parents. And if parents are smoking and using tobacco products, children are more likely to view that as something that's acceptable, and the desirable behavior follows. You know, communication is also essential. That open communication and honest communication about the dangers of tobacco use at young age is so essential. Parents and caregivers must feel comfortable discussing their own exposure, as we did today, to the impact of, actually witnessing family members smoking, and emphasize the importance of avoiding tobacco products at all costs, so they won't influence the attitudes of our children, and setting boundaries. Rules in the home were critical. It was always, for my parents, do as I say do, not as I do. And I follow that rule, fortunately, and have never smoked a thing in my life. So that rule worked for me. So setting those boundaries and being able to provide also support. I'm telling you, our young people are up against it. The peer pressure is real for them. And all around them, they're getting mixed messages about what is not harmful, what is cutting edge. Tobacco, cigarettes were not cool, but vaping is the coolest thing to do, and it tastes good too, Dr. Monica. So why shouldn't I do it? All of my peers are doing it. So for the intergenerational pattern to be broken, we must have education and awareness. We have to provide messages across the board. Like my good colleague Manu said, we have to have marketing companies that will emphasize the dangers of these products early on. School-based programs need to emphasize being able to have prevention and not expulsion for young people who have been exposed to vaping products and the targeting that has taken place for them to use. Community initiatives that we talked about, as well as public health campaigns. The access to resources is also so essential. The cessation programs and resources that our community needs has to be heightened, and reducing stigma around tobacco use also needs to come into play, because the idea that somehow you're defective because you have been targeted and now you're addicted, that has to go away so that the resources can actually be impactful for families. And then addressing, lastly, the social and environmental factors, recognizing that poverty, we know racism, we know socioeconomic status, we know all the things that plague our communities are realities that lead to wanting to feel better. The stress alone, we just want release. And so being able to have better positive things in our environment in order to mitigate these stressors and to provide healthy ways for people to be able to cope with the life realities that Black people are up against daily is something that we must also do. And I believe that those intergenerational patterns with those shifts can actually change and make a difference in the lives of Black people now, and for the generations to follow.
Thank you for that. So, Elder Foy, share with us your thoughts on what role does faith communities play in supporting and advancing individual community health as related to tobacco use?
Well, the principal job of the faith community is the promotion and promulgation of life. Mm-hmm. And that is our core tenet. It is our core mission. Preserve life, advance life, extend life, as far as we can here, and then into eternity. And so when I engage other leaders in the faith community, specifically on the issues of life, I engage them in a much broader context than they're used to. Because when we talk about life in the political context, we're usually focused on other areas, but not focused on how to confront predatory industries and predatory products. We easily identify predatory financial instruments and root them out, redlining, insurance redlining, and payday lending. We can identify these things. We can identify the concept of life with respect to criminal justice and how Black Lives Matter in the face of aggressive policing and law enforcement, but we don't tend to discuss it in the context of how to hold corporate America and the private sector accountable for the destruction that they reap on Black and brown and indigenous communities across the nation when they produce and promulgate these predatory products. And so we've got to broaden our perspective in terms of how we stand up for Black lives in communities of faith. And that means standing up to an industry that has profited and continues to profit for 400 plus years from both the enslavement and the biochemical bondage of Black folk. We can't preach liberty and freedom on Sunday and not stand up against those that try to continue to maintain a relationship of bondage and servitude on Monday through Saturday. If we don't stand up to big tobacco, if we don't stand up to other industries that profit off of our death, then we are really violating our vows and breaking our covenant. And so that's the message I tend to bring. And it's not an easy one. Got to be honest with you. It's not an easy message to bring to people that are used to having their leaders stand up for their rights, but not leaders to stand up and say, you've got to be accountable to yourself, accountable to your community, accountable to your family. And that means standing up against an industry that wants to continue in perpetuity to keep our community in biochemical bondage and economic bondage. Cigarettes are not cheap everywhere you go.
That is very true.
They take a toll.
Yes.
They rob us of our lives and they rob us of community wealth. The money we spend on tobacco, we could be investing in education and infrastructure and skills development and public health. But we're spending billions and billions and billions of dollars a year to create chronic health diseases, terminal health diseases that we will then have to spend billions and billions and billions of dollars a year to treat. And that wealth is coming out of Black and brown and indigenous communities in a way that's disproportionately harmful and cripples our ability to really give our children a better shot in a better world than we had.
Got it. Thank you, Elder Foy. Dr. Wilson, I was really excited to look at your interest in your background. So share with us how the growing prevalence of vaping and e-cigarettes contribute to the emergence of a new generation of Black smokers, and what are the potential consequences of this deadly trend on the health and well-being of Black communities and families?
Well, we know that like traditional tobacco targeting, it has now seeped in to a whole nother generation around vaping and e-cigarettes. These companies have reached out to marginalized communities with their advertising and their promotional strategies that make this idea that it's non-harmful, much more appealing for Black individuals to get, and leading to higher rates of experimentation among our Black children. The idea that vaping products are often marketed as safer to alternatives to traditional smoking, unfortunately, has led to individuals with a misconception. The lower barriers to experimentation around that has contributed to higher rates, unfortunately, of vaping among Black populations like we've never seen before. Another bait and switch, another, as Elder just share with us, another mentality to pull us into levels of addiction. And also for our young people, the social influences and factors of peer pressure, this being a social norm and the cool thing to do, also has led to the uptick of them actually experimenting, with vaping and normalizing it. This is what we just do in the Black community. You just smoke. That's what we do. And we know, unfortunately, the health disparities has increased the prevalence of tobacco-related illness. We know lung cancer is the correlation, heart disease. Compared to any other racial group, the Black community is affected the most. And we have another generation coming behind this that are also now feeling that impact. And the addiction and the dependency. Oh my goodness. Once the vaping products, if we understood the amount of nicotine chemicals and every other unhealthy thing that's in these pods that are going into the lungs of our young people, the addictive nature of these products, the long-term health consequences that we know it's going to have, and obviously, just lastly, the financial strain. That is the truth. Purchasing these products, billions of dollars are being poured out of our community. Unfortunately, we already get impacted by financial challenges, and that burden that places on the family, the individual who's addicted, the guilt and the shame that comes with it. So the psychological implications and the mental health implications that I have already seen in our young people that don't understand why they cannot stop, even though they're not feeling well after they do it, even though they want to quit. Why can't I stop quitting, Dr. Monica? All these things are the impetus of why we must advocate to eradicate and fight against big tobacco, and obviously educate and support our community in knowing what can be done if you are affected by it.
Yeah. Thank you. I want to bring Dr. Neptune back into the conversation because I really want you to talk a little bit about how tobacco use not only affects the individuals, smokers, but those around them and the health of those around them.
That's also really a wonderful question, but that too, in a certain way, ties into what Dr. Wilson was saying before about the stigmatization, because many people want to judge kind of the persons exposed to secondhand smoke as being the innocent victims. Mm-hmm. And this stigma doesn't just have to do with kind of the lay population and within families. That same stigma is actually expressed by physicians and the way they encounter patients who are active smokers. And it's also expressed by funding agencies who on the whole will underfund diseases that are caused by chronic tobacco use. So we need to remind ourselves that addiction undermines choice and addiction is biological, and that these companies have targeted communities to experiment at a stage in life when you experiment with everything. And they establish behaviors that lead to chronic use and lead to addiction. This is a plan. This is a business plan. So we can't allow the stigmas to persist. But the secondhand smoke exposure is a reality. And the data that we've acquired over the last several decades have shown us that secondhand smoke exposure leads to a variety of medical disorders. But the one that we should pay such attention to is pediatric asthma. I think we all remember that in the 90s. Remember when that statistic came out that 25% of children in Harlem had asthma? And the idea was, what is that all about? What we know now is that secondhand smoke exposure within the home had a tremendous input on that statistic. And that means that when an adult or someone in the home stops smoking, you don't just get benefit for the smoker, you get benefit for the whole household. It's a family benefit. It's a community benefit. And we need to remember that when we're counseling patients to stop smoking, that there are broad benefits. And the other issue that we need to kind of remember, and I'm going to tie this into it because I think it's very important, is that when we start thinking about cessation and we start thinking about policies that will promote cessation, we also have to think about making sure those services that are most likely to help patients quit are available, are affordable, and are emphasized by the healthcare community that smokers engage with. And what many people don't realize is that we have a way of helping you quit. We have the medications, we know the support interventions that are needed. It's just that not everyone has access to them. And I am not someone who will ever believe that handing someone a quit line number is sufficient to help them quit. I think cessation strategies have to be customized to communities, to populations. We need to know more about what different communities are asking for, because we know that the African American community is different from the mining community in West
Yeah.
Virginia, which is different from kind of Southerners who smoke. And we know that there are differences. And yet there's a sense that everyone needs the same cocktail of interventions to stop smoking.
Right.
No, they don't. We need to focus on the fact that physicians and caregivers need to customize their approach to tobacco cessation in order to adequately help their patients. But there's one other point that I want to raise about cessation, and this is something that many physicians don't realize. I think we all have heard of lung cancer screening for former smokers. And that means getting annual kind of imaging CT scans to look for early tumors. The group with the greatest benefit from lung cancer screening are African American men. That message has been retained within the research community, but not disseminated among African American former smokers, that they need to inform their physicians that they should get regular lung cancer screening in order to detect early cancers. It's a reminder when one of my favorite actors on the planet, Andre Braugher, died earlier this year from lung cancer. I thought we need to support our community to let them know what data we have and what data will impact kind of the long-term consequences of tobacco use.
Thank you, Dr. Neptune. This actually brings me to a really great question for you, Ms. Jones, as to what resources and support systems are available within Black communities to help individuals and families really address tobacco addiction and promote that smoke-free lifestyle across the generations.
Yeah. So, I mean, as Dr. Neptune said, we do have a 1-800-QUIT line, right? But that alone is not going to get it. We know that unfortunately African Americans in large part turn to cold turkey,
Right.
and that has shown to be one of the least effective ways. So we have a ways to go, in making sure that we're providing adequate resources. But here's the catch to that, right? We have to be at the table to tell people what we need. You know what I mean? We have to, your community organizations, my organization, Making It Count Community Development Corporation, we are part of a national work group with Appeal. And they're working on, that's Asian Pacific Partners for Empowerment, Advocacy, and Leadership. Shout out to Lou. We have to organize and do for us. We don't need other folks coming in and telling us what we need. We need the financial resources to make it happen. We need organizations that have done this before and have a proven track record. Look at what California is doing. African American Tobacco Control Leadership Council, Center for Black Health and Equity. We have experts in our field. Look at the experts that we have here today, right? But it's about raising the visibility of our experts, right? Trusting the voices of the community for us to tell people and organize what we need, what works best for us, and making sure that those financial resources are there without restrictions, right? We look at the federal dollars, right? And that's great, but we also need private dollars, because those federal dollars alone don't go into some closed doors where those discussions and deals are being made, right? So we need it from both sides. If you got money, we need it. right? And the federal government needs to step up. We
That's
should
right.
not be having this conversation about banning menthol in 2024. It
Mm-hmm.
should
Well,
have been done
A
years ago.
long time ago.
well, Miss Jones, that will lead us into the 3 minutes that we have left on the panel, and I'm going to go to you, Elder Foy, to actually talk about how policy interventions such as prohibiting menthol cigarettes can help mitigate the generational impact of tobacco use on Black families and help us to promote healthier lifestyles.
Well, I just have to just dovetail off of my sister Jones and her admonition of the federal government. You know, there are five tenets that comprise my approach to this tobacco thing, and we've discussed most of them. Is public health. We have the data that shows the disparities. We have the data that shows the death rates. More people die from secondhand smoke than die from gun violence in this country, and we have the data that shows that it's fiscally responsible to tackle big tobacco's grip on Black and brown and indigenous communities. We know that there's a consumer protection issue here. It's a predatory industry and a predatory product, and we know the history that tobacco has with Black, brown, and indigenous communities in this country. But as a civil rights guy, I have to fall back to the equal protection argument. In 2009, the federal government banned all flavored tobacco products, all flavored cigarettes, with the exception of menthol, which means they left Black and brown and indigenous communities vulnerable in a disproportionate way to other communities, vis-a-vis other communities, to big tobacco's marketing of this predatory product. They refuse to provide equal protection
Right.
to Black and brown communities that they provided to young white communities. And when we saw vaping happen, exploding and changing the trajectory, the downward trajectory in tobacco consumption among young white people, we saw state by state them banning flavored vapes, but continuing to leave young Black and brown and indigenous people vulnerable to the machinations of big tobacco. This is an equal protection argument. And we can't talk about achieving a cancer moonshot without banning menthol cigarettes. We can't talk about equal protection under law without closing the menthol loophole, which was created in 2009. We cannot have a conversation, Mr. President, about what the Civil War was really fought about. It was fought over slavery. We understand that, but you can't stop there. You've got to say that it was tobacco that funded the Confederate South.
That's
So
right.
we've got to have a real conversation where we hold the federal government accountable for its lack of equal protection of Black and brown communities in the face of billions of dollars of lobbying and marketing and public relations campaign coming out of a predatory industry that has done nothing but brought death and dismay and destruction to communities all across this country, irrespective of race, and continue to transfer tens of billions of dollars of wealth from communities that are most economically vulnerable into the pockets of big tobacco. And we need the federal government to stand up and to provide equal protection under law. That is their obligation under the Constitution. And we expect that the president will see through with his commitment and see through with his commitment to not just the cancer moonshot, but to equal protection under law.
Well, on that note, I'm going to go with let the church say amen on that one. And that was a great way to end this part of our presentation. I really want to thank you, Dr. Neptune, Dr. Wilson, Ms. Jones, and Elder Foy for joining us for this part of our conversation. And we're now going to transition and we're going to move into our fireside chat. And I want to bring in for this our youth advocate, Mr. DJ Yarwood, to have this really important discussion with me. How are you, Mr. Yarwood? Can you go ahead and talk to the folks and talk to us about what brings you to this work?
Yeah, my name is DJ Yearwood. I'm from Kansas City, Missouri, and I was brought to this work because, like many of the other speakers, I too come from a family of smokers. I too come from a background in the neighborhood where these products are pushed and carefully placed and marketed. And it just doesn't sit right with me, right? I don't like the downward spirals that I've seen my peers on, downward spirals of addiction. I don't like the targeting, and I don't like the overall outcome that is brought along with these products, keeping communities poor, keeping communities down, and the loopholes that are continue to be found in Missouri and across the country.
Absolutely. So, what really did inspire your journey as a tobacco advocate, and what some of those key experiences or insights that have shaped your advocacy efforts in combating tobacco use?
Yeah, so I'll first start with saying the fact that first, my family is staunch cigarette smokers to this day. And all of that accumulated to the fact that now one of my grandmothers has been diagnosed with lung cancer attributed to her smoking, her lifetime of smoking. And but the real catalyst was when I became a defense attorney for the Jackson County Youth Court. And I really got to see the amount of young people who were getting punished for being in possession of or being caught using vapes and tobacco products. And what really was the catalyst for me, and this is a pivotal point, what really was the catalyst for me was when a fourth grader was being charged with possession of a vape. It was a fruity pebble flavor vape. She was I don't know her age, but she was a little black girl, and she genuinely did not know that there was anything wrong with what she did. I believe her. She genuinely did not know that there was anything wrong with what she did because she openly used it in class. And so she didn't even try to hide it. And so she had told me, I just thought it was flavored air. I thought it was, I've seen people do it. I saw my sister do it. I've seen people do it. I thought it was flavored air. She hit it right in front of her teacher. And so the problem becomes, and what clicked for me there was that this fourth grader cannot make it through her class without hitting a vape. That's pathetic. How pathetic is it that we have allowed industries to target us up to the point where elementary school students can't make it through the class?
Yeah. So fourth grade, she was about 10 years old.
Yeah.
What impact do you believe that advertising and marketing have on smoking behaviors within this young population?
Yeah, so first we can take a look at what those advertisements are, right? We've got advertising such as indirect advertising. So when they're trying to be sneaky, maybe product placement in the video of an influencer, when they're trying to send a PR package to someone like Cardi B, or when they just flood certain neighborhoods with ads, and so or the flavoring themselves, right? And so the flavoring is what I think is most pressing. But as for the rest of the surrounding marketing methods that we've seen, like sending PR packages to celebrities who have a high youth following, things like that, when we see those things come into full effect, it's to the impact of thousands of young people who are watching and listening. The flavors themselves are highly attractive to youth. And so we come to a point where schools are now responding by taking bathroom doors off. They're installing vape detectors in the bathrooms. They are overly punishing students, fueling that school to prison pipeline that already targets Black students, right? And so it's just a full sweeping just down spiral.
When it comes, you actually mentioned that fourth grader that you mentioned, she was using a fruity pebble flavored. So isn't that one of the strategies that these companies are using to market these e-cigarettes?
Yeah. So fruity pebble flavor. She had a fruity pebble flavored vape, and I'm sure that we all can realize that that flavored vape was not made for some 40-year-old, right? That vape was made for her. It was made for her. And so when we are really looking into it, and I guess you could say investigating, what the tobacco industry is doing, they're not even really trying to hide. And so, and so the industry's tactics have been very evident in how they're targeting young people, and it's been successful.
Yeah, because it seems like that's one of the things that they're using to hook the kids, using
Right.
those familiar labels like their favorite cereals or candy, in
Or
those
shaping
tactics
them
that
differently. You're right. Shaping them like
exactly.
toys. Yeah.
Well, that leads me into another question then. How do you think that parents and mentors, schools, and our educational institutions can contribute to preventing smoking initiation among our young people?
I'm glad you asked this question because the previous panelists really had touched on it, and I wanted to really ride that wave. I believe it was Dr. Neptune had mentioned, enough with the quit lines, right? So if I go into a bathroom at my old high school, I would see a poster with a quit line, right? Or at high school, we might get a presentation here and there about why vapes are bad, right? Know your audience. High schoolers know why they're bad, right? It's the the fourth grader who did not know why this was bad, right? So target the education appropriately is the first thing. The second thing, and I think the most important thing, is to stop treating addiction like a crime, right? And so that's where it's most important for Black and brown kids, right? Because there's already something, the school to prison pipeline, that is fueling and funneling Black and brown students into the prison system. Adding this aspect of treating addiction like a crime is only fueling that, adding gas to the fire, right? And so when we're considering how we can approach this, it's only with rehabilitation. It's only with the direct resources that the other panelists mentioned. No other way, no other way of suspending students for leaving class to go vape in the bathroom, resulting in them missing more class, is going to benefit the students or make them stop. Sending them home to go vape at home is not going to make them stop. Yelling at them and dumping out their backpacks to search them in a very humiliating way is not going to make them stop. And so we've got to really approach the way that we address it. And that first starts with educational institutions, because boy, oh boy, are they getting it wrong. The second thing is the fact that there are youth courts in general, right? So I'm proud to say that I'm a defense attorney, and I've been able to do a lot in the youth courts to help students get that rehabilitative help. But the fact that they're being referred to a court in general is fueling the fires, is fueling those fires. And so there's just got to be a sweeping effort to really shift the way that we're addressing that.
So help me understand, and our audience to understand, how is it that these products are sold so freely, but yet they're criminalizing the behavior of the youth that are using them?
Yeah, because their priorities are mixed up, right? So we have such little focus on how they're getting the products and more focus on the fact that they have them, right? And so, for example, I was sitting in on a conversation with it was some meeting of school administrators, and I was a student representative. It was a couple months back, and they had talked about how they were talking about, that the crisis, right, that they're facing. However, they had ignored the fact that they had played a video. I guess it was some educational video or something, but they had played a video in which the student said, "I know this one gas station where they won't ID me and they'll sell to me." So you just ignore that whole part and you just focus on the fact that they got them. And so what we've really got to do, like I said, is shift the dynamics, shift the focus, punish the cause of the addiction and not the person who was addicted.
Absolutely. Well, on that note, as a youth advocate, what advice would you give to inspiring younger advocates who want to get into this fight against tobacco industry and to promote social justice?
Yeah, I think that the first thing is, and what really helped me, I will say, is first realizing how big of a social justice issue it is, right? Getting that communicated. There are so many social media activists who were, typing away, for Black Lives Matter, typing away for different social justice events in the recent years, right? Um, and all it takes is us helping to recognize and paint the light and shed the light on the fact that this is a social justice and civil rights crisis, right? Elder Foy was just saying, this is a crisis of something that should be looked at uh, as a civil rights crisis, right? And so as soon as that gets painted, we have a bigger audience, right? We have more people who are like, wait, I'm not okay with this. It's not so apparent now. It's so normalized now. The people don't go around and thinking, oh, a cinnamon toast crunch vape, that's made for a 5-year-old. They just think, that's weird to have that. But when you start seeing it more, you see a minion toy shaped vape. Those things become more apparent. So we've got to really shed the light on what that is, and also the history behind it.
Mm-hmm. Fruity Pebbles, Cinnamon Toast Crunch. I mean, what are some others that are out there?
Dr. Fields, I could go on for days. There's Jolly Ranchers. I had spoken at the governor's bill signing event, and they had some examples. There were some blueberries. And then the product placement too, right? They're placed right above candy. This past summer, I took some pictures for some CTFK events, and they're placed next to fruit snacks and Reese's chocolate, and they just look like they're targeted to
very
kids.
benign.
And it's not on accident, right? No store, no company does product placement on accident. Everything is intentional.
Well, Mr. Yarwood, this has been a really fascinating conversation. What final message do you want to leave with our audience this evening?
Yeah, I just want to say, to listen to students and to really work on enforcing that shift in dynamic. School boards are responsible for fueling the crisis if they lack the integrity to take action on the crisis that's taking place. It's more of rehabilitation than punishment, and it has to be. That's the message I want to send to parents. That's the message I want to send to educational institutions. That's the message I want to send to youth courts across the country. It's a crisis, and it's not something that should be or is effectively responded to by punishment.
Well, thank you very much, Mr. Yarwood. You have added a great deal to this conversation this evening. So as we draw a curtain on this illuminating discussion, I want to extend a heartfelt thank you to our esteemed panelists for their invaluable contributions to tonight's dialogue. Your expertise, your passion, and dedication have illuminated the path forward in our collective journey toward health equity and justice. From innovative solutions to steadfast advocacy, your insights have inspired us all to take action. The White House needs to honor its commitment by swiftly issuing a final rule to eliminate menthol cigarettes, disregarding the fear tactics of an industry accountable for the deaths of millions of Americans. Your assistance is crucial in ensuring this pivotal action reaches completion. Please call the White House switchboard at area code 202-456-1414. That's number 206-456-1414. And tell them to finalize the rule to eliminate menthol cigarettes now. Let us carry the torch of knowledge and empowerment into our homes, schools, workplaces, and communities, armed with the resolve to educate, advocate, and affect change. Together, we can rise above the obstacles, transform our communities, and create a future where the impact of tobacco on Black lives is but a distant memory. To our audience, thank you for your unwavering support and your engagement. Your presence tonight signifies a shared commitment to a healthier, tobacco-free future for us all. Until we meet again, let us continue this journey together. Good night, and may our collective efforts pave the way for a healthier, brighter tomorrow.